Hello, guys. Welcome to the third episode, episode three. And in this episode, we're going to talk about pregnancy and dental changes. Pregnancy is a normal thing, it literally happens every day. And the reason why I also say that is because starting from last week, I became an uncle. So pregnancy is a wonderful thing, and it's a common thing. And not many doctors talk about how it actually affects your dental health. So, today we're going to talk about that. Of course, we have the amazing Dr. Buleni with us, who's gonna walk with us through all of this and tell us how pregnancy affects your dental health and how you can, prevent that from having things like gingivitis and all of that. So I hope you enjoy this episode. So before we start this episode, though, I would like to ask Dr. Buleni, how are you? How has everything been? Have you enjoyed your Easters? And what's happening? Update the people.
Uh, Hi, Benin. Hi, everyone. Thank you for watching. I was laughing when you're saying, pregnancy happens every day.
It's kind of true, though.
Yeah. No, all is well. Thank you guys for joining in. Today we're talking about something that happens every day, which is pregnancy and how it affects your teeth.
Hmm.
Yeah.
Yeah, nah. Let's get straight to it. I'm first gonna ask you this question. It might be a bit broad, but can you just give us the overview of how pregnancy affects your dental health? Like, if you would just tell someone if they were interested in asking actually and wanted a quick answer, what would you say to that person?
Pregnancy affects the
No
teeth in
problem.
so many ways. For an example, because your hormones are changing, you have a high increase of progesterone and estrogen. You have
Mm,
heightened senses. You are irritable. You have cravings. All of those things indirectly and directly affect the teeth. For an example, an increased progesterone and estrogen makes the body intolerable to plaque. So even if you have just small plaque in your teeth, in between your teeth, if you're not flossing, if you're not brushing
mm,
properly, then your teeth will be, your gums will be inflamed because of the heightened senses and the irritation of the body due to the increased estrogen and progesterone. Uh, with the increased cravings, you're eating a lot of sweets, a lot of cakes, a lot of junk because you are craving all these things. Therefore, you are increasing the intake or the exposure of your teeth to acidity or sugary stuff or high refined carbohydrate food.
mm,
Let's talk about the morning sicknesses and the acid reflux because you wake up with, feeling like you're nauseous, or sometimes some people even vomit. Taking all the acid from the stomach to the mouth, that destroys the teeth. It weakens the enamel quicker than somebody who's not pregnant. So those are all the effects, and also because of the change of the mood. Some people, when they brush, because they tend to touch the back of their tongue and they feel like vomiting. So even brushing becomes a nuisance for them because it's irritating them. Even flossing is irritating for them. So they end up just using a mouthwash on there, which is insufficient to keep your mouth clean. So those are the things that
mm,
affects your mouth during pregnancy, directly or indirectly. Back to the diet as well, because most of the time we tend to eat more junk and we neglect eating a healthy, balanced diet. Then our teeth are then affected through eating and also through the nourishment of the food that you are eating, or insufficiency of the nourishment that you're eating.
mm. Oh, Dr. Belen, by the way, you're gonna make a lot of women angry because are you basically saying they cannot feed their cravings? Because during pregnancy, they have a lot of cravings, and most of those cravings are usually bad food for the teeth. So I encourage a woman to not feed their cravings.
not. There are healthier alternatives, you know. For an example, if you like
Mm,
chocolates, go for dates. I mean, they have a similar texture, and the nice thing, you know, they're healthy and have a better benefit, you know. Uh, it's more fruits and veggies. I mean, um, I think the market is now much more friendly to us in terms of, or mostly the vegan stuff, because those are the alternatives that you can use because they are much healthier with the same benefits.
mm,
And some they even make the chocolate that are vegan as well. So even the chips that are vegan, you know. So I would say 80% of the
mm.
time, try to eat healthy or maybe substitute to vegan friendly uh, chocolates and sweets and you know and drinks more than anything. But yeah, do satisfy your craving in a healthier way though. Think for your body, think for your teeth, think for your baby, think for the after effect as well. You know, because I mean, after 9 months you won't be pregnant anymore, but you'll be stuck with the lingering effects of not taking care of your teeth or neglecting your teeth when you were pregnant. I mean, during the 9 months.
Mm. Thinking about it, I'm like, wow, pregnancy definitely affects the dental health because I know some people also crave ice, which is even bad for teeth as well. So yeah,
Yeah,
I
yeah.
can just imagine.
Yeah, definitely. That is iron deficiency. Some they even eat the soil. I mean, I know.
Mm.
I mean, in my rural areas, they'll even go to the area where there's the soil that they can eat, and once they ate that, they feel they're
Wow.
you know, yeah. So if you know you're craving the soil, you're craving the ice, just know you are iron deficient. And I'll really suggest that you take the pregnancy supplements. If you're thinking of getting pregnant or planning to be pregnant, take the supplements and while you're pregnant and also post pregnancy. And I'll say it's a taboo thing. I'd like to say now, from your 40s or premenopausal, I'll say take the pregnancy supplements to balance your hormones as well, because it does help.
Mm. Would you encourage, when would you encourage a woman to visit the practice, like during pregnancy or after or both?
I always encourage that you visit the dentist or visit us every 6 months. So obviously, if you are visiting us every 6 months, we would see things prior or during and be able to, you know, work on them before they become severe. But if you
Mm,
haven't been to the dentist and you find yourself pregnant, uh, you might come through. Please come through, even if there is no pain, just to make sure that you don't have any pain or any issues during your pregnancy, because we cannot prescribe antibiotics at that point. But in some cases, with the help of your gynae, then we can. But it must be closely supervised. So I would really suggest that you
mm,
come, even if if there isn't any pain at all, just come through for a dental checkup. Should you have any issues, please also come. Let's see how we can help you. In some instances where it's really severe, we can infiltrate around the tooth. We can, if we take the radiographs, obviously with all the precautionary measures, and also in communication with your gynecologist. So we work hand in hand in such instances. And obviously, we try to avoid any invasive treatment on the first and the last trimester. On the first trimester, because the body is still developing, we don't admit any adverse things affecting the body formation. On the last trimester, we can induce what's this labor. So we try to avoid that.
wow.
The second trimester is quite the safest one to be able to do even your root canal treatments or I mean, removal of the teeth. So if you have pain, please visit your dentist. Don't wait. Don't suffer for 9 months. No, don't do it. Yeah.
Wow, that's actually shocking. So you're telling me the last trimester, like if any treatment is done, it can actually induce labor?
It can. it not that it will, it
mm,
can induce labor. So we try to avoid as much as we can. But should there be a point whereby we cannot, we can,
mm.
but should there be a point where we cannot uh, 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 lost my train of
Avoid not
thought.
treating you.
Yes. Should there be a point where we cannot avoid treating that infected tooth? Let's say you came in abscess, swollen, can't sleep. I mean, we've had such
Mm,
cases. So I had a communication with the gynae, and then they gave the lady the antibiotics, and then she came through for the extraction, and we relieved the lady from the pain, because now we don't want an issue of having sepsis, you know.
mm. So we've heard a lot about this term called pregnancy gingivitis. I don't even know if that's a real thing, and if so, if it's a real thing, how does it happen? Why does it happen? And I guess the follow-up question would be, will it then affect how the baby forms or your pregnancy period? And will it have any effect on the baby in any way if you have like pregnancy gingivitis?
Okay. Yeah, it will. It will. So pregnancy gingivitis is gingivitis that happen while you're pregnant. So gingivitis is the inflammation of your gums. So it
Hmm.
happens because there's a higher production of estrogen and progesterone, you know, that makes your gums to be more reactive towards your plaque. It it can show up as swelling, it's tenderness, it's bleeding. If you feel like you have a metallic taste in your mouth is more
Hmm.
acidic, more dry, obviously it's going to make bad breath, and more likely you'll have, what's this, caries, decayed teeth. So yeah, it happens, and sometimes uh, we would diagnose it and tell the patient that they are pregnant before they are awake, because we can see the pregnancy gingivitis
Mm.
in the mouth. Uh,
So that's like a pregnancy test in a way.
yeah, it's a dental pregnancy test. I'll
Yeah.
say it's a dental pregnancy test. Um, so yeah, it happens. Like I said, the other things also affect the acid reflux. You're lazy to brush. You're just fatigued. The food cravings. The increased vomiting. So yeah, it
Mm.
happens. And you asked about the affecting the baby. It will affect the
Mm.
baby, because if you have pregnancy gingivitis, it can show as what's this? What do they call preterm birth, or also a low birth weight for your baby. So
Mm.
it does not also mean that just because you have gum problems while you're pregnant, or you have pregnancy gingivitis, then you'll have those complications. It just means that you need to take care of your teeth, you need to floss. You know how important flossing is, even if you're not pregnant.
Yeah,
Yeah.
that's true. Yeah, so you spoke about vomiting, and I just wanna go back there because that's also like it also happens during like morning sickness, right? So
Yes.
how can someone who's aware of the fact that okay, my enamel is gonna get damaged because of this phase of morning sickness and all of that. So what should I do like to still protect their teeth and remain healthy?
Um, with the vomiting, drinking frequent water, for some people it helps. More alkalinic water helps. So for some people, they'll put just a pinch of bicarbonate of soda in their glass of water. Not that they're brushing with it. They put it in the water because it is more alkalinic. It's like a pH of 9. bicarbonate of soda, and
mm,
then drink that. So that helps with the gag reflex or the acid reflux or that feeling of wanting to vomit. So drink
mm.
more water frequently, especially the alkalinic water. I know Woolworths have water is rich in the alkalinic water. So if you wanna go that route, buy Woolworths water. Or if you're craving ice, go for Woolworths ice because yeah, it's more alkalinic. So yeah, I would suggest you do that, and be aware of when you get that feeling. Is it in the mornings? Is it some certain smells? Because now all your senses are heightened. Some people even don't like the smell of their own partner or their home. They feel like I don't like the smell. You find that the food you like before you don't like anymore because you're pregnant and you find yourself liking something different,
Yeah,
or maybe your sense of perfume you liked it, but now since you're pregnant you no longer like it. So you feel like you want to use something different. So be aware of what exactly triggers your nausea and try to avoid it. And it can
mm.
be tricky
And can
though
we?
if sorry.
No, no, you can continue. I'll ask the next question after.
Yes, I was saying can be tricky though if flossing and brushing then gives you that reflex, because I need you, we need you, your baby needs you to brush your teeth properly, especially during
Yeah.
pregnancy. Yeah. So for those people, I would say probably try to brush as early as possible in the morning before you do any other thing. Also at night, just give yourself 30 minutes after eating before you brush your teeth so that even if you have that
Mm,
gut reflex, there's nothing that comes out. It can just be
yeah.
the feeling, yeah, without something coming out.
Yeah. I spoke about affecting the baby, but does anything affect the mom concerning like when you're pregnant, right? Because I would think if a baby's forming inside of you, that means they're taking every nutrition, and every vitamin from the mom. So what then happens with calcium? Because we know calcium plays a huge role in your dental health, and specifically talking about teeth. So if the baby takes up calcium, right, to form inside, because then the baby will form bones and all of that, then does the mom end up needing more calcium to keep their teeth strong, or like what then happens? You spoke about pregnancy supplements as well. Maybe that includes calcium. Can you tell us maybe what's in the pregnancy supplements as well, if you know?
Let's stop blaming our babies from taking calcium. Uh, babies don't, okay, they don't really take the calcium directly from the mother,
Mm,
or the teeth does not like donate the calcium directly to the baby. You know, uh,
yeah,
the
yeah.
real culprit here is all the things that you've mentioned: the plaque, the vomiting, the dry mouth, more frequent snacking,
Mm,
neglecting the existing dental problems. And the poor diet.
mm,
They all affect your maternal health during your pregnancy. So I would
mm,
say the baby does not take calcium from you. The baby does not make your teeth to be carriers, because you'll find people who have had multiple babies but they have not lost their teeth. It all goes to you and your brushing. You need to make sure you floss your teeth. If possible, use put fluoride in your floor so that it goes in between your teeth. You brush your teeth properly. You eat a balanced diet. In that way, you would not be feeling like your baby's taking calcium from you, and making your teeth to be rotten. You just have to be in cognizance of all those things. And then when it comes to supplements, I would then say, if you feel that the baby is taking some nutrients from you, okay, the baby is taking some nutrients from you, but not really like directly in a way. In that
yeah.
way, it, I mean, please take the supplements. The pregnancy supplements, they include your calcium, your vitamin D, your magnesium. It's just a combination of tablets that really help with supplementing yourself and the baby as well. Some include iron, some will include just general multivitamins and mineral tablets, and include some omega-3 fatty acids, which are really beneficial for your health, for the brain health of the baby, for your health as well, and also for your recovery. Like I mentioned earlier on, that you can take this before pregnancy, pre-pregnancy, during pregnancy, and also after pregnancy. Some even include folic acid. So take what you need. Obviously, when you're pregnant, your medical doctor will take some blood test to check what you really need. Then do that, please. Stop blaming other people.
I guess you heard stop blaming the babies. So one last question is that, like, what do you wish every pregnant woman knew um, about their dental health while being pregnant, or even before entering or coming for the appointment? What do you wish, like, what do you normally see that'll make you be like, oh, they're making the same mistake all the time when it comes to pregnant women?
Okay, what I wish every pregnant woman knew was that you have to
Hmm.
plan. You plan your pregnancy. Should you find yourself in that position, embrace it. Take care of your health. Visit your GP. Visit your dentist. Eat a healthy
Hmm.
diet. Obviously, do snack as well, but in moderation as well. Not only for your teeth, also for your body. You don't want to be losing your body, and then because it's going to take you a while to go back to your natural shape afterwards.
Yeah.
Just remember that the body is interconnected. It's not like the teeth are here, then the body is there. The teeth are in the body. They are all connected. So bleeding gums,
Yeah.
sensitivity, dry mouth, nausea, and cavities are easier to manage earlier than late. So should you have any issues, visit the dentist immediately. You don't want to wait until later in your pregnancy. You know, uh, just remember that it's not a luxury coming to a dentist. It's a necessity. It's part of your oral health. Uh, I know World Health Organization says there is no health without oral health. Just think about that. There is no health without oral health. So
Mm.
make sure you visit your dentist, take the supplement, take the necessary blood test so that you can take the necessary supplements you need for your teeth, floss, brush, drink water. If you find yourself vomiting, I forgot to talk about that.
Mm.
When you find yourself that you're vomiting every time in the morning, rinse with water. Don't brush your teeth for 30 minutes. Why 30 minutes? Because the pH in the mouth takes 20 minutes to return to normal. So you don't want to brush your teeth
Mm.
immediately after the attack of the acid. So wait 30 minutes and then brush your teeth. But in the meantime, it's either you rinse with water or you rinse with alkalinic water, whether it's your Woolworths water or the water with bicarbonate of soda, or you can
Yeah.
use a fluoridated mouthwash. If you don't have that, what you can do, just put a little bit of toothpaste in your finger or on your tongue, and then you move around, just rub it with your finger or with your tongue on all your teeth, and can spit the remainder, and that's it. And wait for like 30 minutes
Mm.
before you actually brush your teeth. Don't brush immediately after vomiting. So yeah, those are all the
Yeah.
things that I wish people knew, because I feel like
Uh,
there's still a lack of information on it, and education when it comes to that.
Yeah. And that advice you just gave about uh waiting after vomiting, waiting like 30 minutes to show that I'm a great student. That's the same advice that goes for people who drink apple cider vinegar water and lemon water, right?
Absolutely, because the enamel has been in under attack. Remember, hold on, hold on. So it goes the same for that, because it's acid. Your mouth has been under acid attack. and with
mm,
the apple cider vinegar and the lemon water in the morning, you are directly putting your mouth under acid attack voluntarily.
mm,
So you just have to make sure that after that, drink water, alkalinic water, fluoridated mouthwash, or the paste, like I mentioned just now. 30 minutes. 30 minutes. Okay,
yeah.
then it neutralizes the pH in your mouth. Then you can brush your teeth. Please. Otherwise, you'll be blaming the
I,
baby that, the baby took my teeth. They were not sensitive before. Since I've been pregnant,
I,
these kids took my calcium. My teeth are sensitive. I've lost all my
yeah,
teeth. This baby.
there's a saying that says, gain a child, lose a tooth. So I think it might have some truth in it.
No, 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 no. There's no truth. The Bible says, "My people perish because they lack knowledge, they lack information." And in this
Mm,
information age, we are giving you the information. I'm here. There's so many videos. Please check out all my videos. I'm always educating people about oral health. If you are pregnant and you know somebody who's pregnant who needs this video, please share with them. Please, please. Don't lose your tooth
yeah.
because you're pregnant. Don't lose your teeth because you're pregnant. Don't have sensitive teeth because you're pregnant. Please take care of your teeth. You can still keep all your teeth
Mm,
with whatever 10, 20 pregnancies that you have.
yeah. And that's great advice. Dr. Buleni, thank you so much for all of this great advice. And I hope all the pregnant women now have a wonderful pregnancy without losing any teeth or, having sensitive teeth or gingivitis or whatever. And we hope that you guys learned a lot. If you know anyone who's pregnant, please share this video with them, or anyone who's planning on, having a baby. And yeah, make sure that they know they must visit the best doctor in South Africa, Dr. Buleni, before even being pregnant and even during. So, you guys have a great day. Dr. Buleni, any last words? Or are you good?
Yeah, thank you. And to you, congratulations, new uncle. Please share this video with the mother of the baby.
I will, definitely.
Because the same instructions apply after pregnancy postpartum as well. Take care of your teeth. So yeah.
Yeah.